one of the reasons I didn't want a cervical check is that labor is intense and you don't know how long it's going to last. And so I didn't want to hear that I'm only at 3 centimeters if I'm feeling like, oh man, right? Because it doesn't mean anything, because you could go to 10 in 2 hours, in 1 hour, or you could be stuck from 7 to 8 for 5 hours. Or like for me, 8 centimeters, I was like, great, I'm gonna have my baby soon. And then I saw 5 hours of like intense labor and transition, when it felt like I'm at the finish line, but I wasn't 10. And so there's no rhyme or reason for how long it will take to go from 1 to 2, 2 to 3, any number in there. And then the things that happen that make you shut down are things that can contribute to stalling your labor if you suddenly feel unsafe or mentally psych yourself out, either way. And I think a lot of times it might push you to go to an epidural sooner because you're like, oh, I'm so defeated, I'm only at this amount.
Welcome to Birth from Within, where inner wisdom meets grounded preparation. We're here to share raw, real birth stories and offer the insight and tools you need to move through the system with courage, clarity, and authority. You were made for this. Your body knows what to do. This podcast is the heart work of a nurse and a perinatal chiropractor, women who have walked our own birth journeys, and now we walk beside you. In each episode, we share practical tools, grounded wisdom, and deep reverence for your body's design. Let's return to the root, because birth doesn't start in a delivery room, birth starts from within.
Cervical checks. Cervical checks.
So much fun.
What is a cervical check?
It's when a provider takes these 2 fingers and sticks them up to feel your cervix. And they're checking for a few things.
How close is the cervix? How thick and hard, right, is the cervix? Because while we're pregnant, the cervix is close and tight and thick. And as you labor start to progress, there's 2 types of dilation, right? Because the cervix, maybe this is too anatomically, but you know, you have the vagina, and then the cervix has 2 openings. The ones that are not touching the baby's head, and then the one that is touching the baby's head.
Which is the top of the cervix.
Yes, top of the cervix, lower cervix. Yes, good. Then it'll start to opening, and then the effacement is like how the cervix is starting to shorten and thin. Yes. But the thing with this is that it doesn't tell us a lot of information about when labor is going to start.
Or end.
Yes.
It's not linear.
Yeah.
And it's not the same for anybody.
Yeah.
So there's not really any rules or sequence at all.
Yes. But standard of care, you're going to start hearing about cervical checks around 36 weeks, right? Like, let's just talk about what's standard of care.
Okay.
36 weeks, you're going to start getting cervical checks probably every time you go
every week
to your OB.
Because we want to see how close you are to laboring. Yes. Which again, this literally, and you can look in the research, doesn't actually tell you how close. You could be a centimeter dilated and be like, okay, yes, things are gonna start. You could be 1 to 3 centimeters dilated for how long? A long time.
Weeks. 4 centimeters. It could be 4 weeks, and still, right? Like, it's not gonna tell you, oh, you're, yes.
Because we're also looking at the baby descending in your pelvis.
Yes.
That's the last thing.
That was the other thing. Yes. The station of the baby.
So if you're starting to dilate, but your baby's still very high, like, birth is not around the corner.
It has to engage. Yes.
Why would you consider not having a cervical check in that case? We're saying it's arbitrary, but outside of that, is there any reason you would decline that?
First, because it's like another stress that you can be adding to, when is this baby gonna come?
Yeah.
And I'm 4 centimeters, get excited, yes, and then weeks goes by. Oh my God, what's wrong with me, right? Nature knows best, right? Like, your body knows what it's doing. Just that stressful or like that mental battle with this myself of, wow, it's not working, or it's not progressing, or I thought I was gonna give my baby at last, the end of the week, and it's still here.
You're very full and uncomfortable just because you have a full-term human baby in your abdomen. So
you mentioned uncomfortable. Cervical checks are very, very uncomfortable. Like, again, just imagine your doctor with 2 fingers going up there to check for the cervix.
Yeah.
So they hurt and they're painful. That was another reason why I won't have them every week. Risk of infection.
Yeah, because you're introducing
something up there.
Which I did read an article, it was surgical gloves versus just clean gloves, and there wasn't enough of a difference to say that you need to have surgical gloves that are sterile. And so they're like, you could save $25,000 at the hospital. And you're like, again, we're always going back to cost instead of well-being of our fellow women.
What's best for us.
Yes. And so you said uncomfortable. I feel like you talked about the physical discomfort. To me, it just feels violating.
Yes.
I don't know many women that are just like routinely on a normal day. I love when somebody sticks their fingers up my vagina.
Yeah. And I mean, they are so used to do it, right? Like there is not compassion for when the doctor is doing, right? Yes. Because they are like, okay, whoop, boom. Like there's
and there might be exceptions, but yeah, it's a very sterile,
yes.
Not sterile, but sterile to them as far as disconnection of just it's routine, another day in the life. Whereas for us, it's like that's a very intimate thing happening, and that we are often led to believe it's a necessary part of the birthing experience. But I'll say with my midwife and our care team, she never ever once, literally until I was in like very active labor, did she say, let's see how far along you were. And then the next time, never once. And you're like, it was amazing. Even we had so much rapport and comfort. And I don't even know if she ever asked me, but it was like, if I wanted one, she could do one, but it was never a thing. And you're like, that only added to my trust, because eventually you have a child coming out of your bottom, but like there was such a safety with her. And so just as women, and the trust value of, you had talked about tensing up, and just how that can be literally the opposite of what we want to be doing in birth, because now we're like, oh!
Yeah.
Fight or flight.
I heard once like anal sphincter works like the cervix. Don't feel comfortable around it, it's gonna close up. Yes. Because that's what they do. They either open when you're relaxed or close up when you're like, again, if you have been pooping somewhere that you don't, you know how that tends
up. And then you might hold it for a week. So if something untoward happens, could that make your body feel like this is not safe to birth? Absolutely, it could.
And if you have also like, just think about people that have been sexually abused.
Absolutely. It's really traumatic.
That's
really triggering to them. And so for them to know this is an option to decline.
Yes.
Absolutely. Just go back to how the baby's made. Like, your husband's not just going right in, right? There's a reason that we're slow to warm up, and that's not an exception in birth.
And like I said, there are doctors and there are doctors. In cervical checks, I hear more of doctors asking, if consent, they want to. But for me to bring this information is more like know why they would do that, and what is the importance of doing it, and what is the information that can give you. So really, the only information would be for the doctor.
It's something to chart, but it doesn't mean anything.
Exactly.
That's where you can hold and say, ooh, okay. Even if you're a data person, as Myra mentioned, it might mess with your head more than help, because it doesn't tell you how soon labor is going to start.
And then there are some doctors too that membrane sweeps are part of their cervical checks,
which is a way to induce your labor.
Yes. And that's another topic for membrane sweep.
But also more discomfort, and it might launch a labor that's not ready. So even breaking your water, if you're not near, if your cervix isn't all the other pieces, if your baby's not in your pelvis, if your cervix isn't effaced, thinned out, and starting dilation, you're launching something that your body's literally not ready for.
I mean, let's talk about dilation. You could be dilated 1 centimeter and then 3 hours later 9 centimeters and go to birth. You could be again 4 centimeters and have weeks, and then you go into labor.
Yes.
So again, very arbitrary of how or when this is gonna start. And then other things that we didn't mention is it could cause spotting or bleeding. It could cause
much more
cramping.
Both of which feel very like all pregnancy. If you're spotting or cramping, that's very emergent and stressful, that you're like, oh my gosh, is everything okay? Why would we willingly oblige to something that could cause that and bring more stress in your labor?
In my experience, I did have one with my last pregnancy, because I was already 41 weeks. I know that, it doesn't tell me anything, but I still chose to, just tell me where I'm at.
Yeah. So there are exceptions, and it's not to say if you want that, don't get it. It's just saying it's another thing that is seemingly overused, and it doesn't have to be the standard of care it is the standard of care. It doesn't have to be what you opt in for every visit. And so use it discretionally, discretionally, because you can use it for information where it's helpful to you, but beware that sometimes that can mess with your head, and you don't have to do it every time. So for you waited, the whole way, 36 weeks versus 41 weeks is a very different state of mind and physical.
And that was also my 4th baby. So, people are like, oh yeah, you're just gonna
Pop it right out, sneeze it out.
So in my head too, it's like 41 weeks, I'm still not. So yeah, just because of that, I chose to have it. But I would decline it every time that I would be, in my hospital setting, because I have both hospital and home birth. So hospital, I would always like, no, I'm good. And luckily, the people that I saw, they were like okay without it. But my first pregnancy, no. I don't even remember that he would say, do you want this? It was like, okay, cervical check, boom. Yeah. Like I didn't feel that I gave consent, which that also happens.
And that stays with you a little bit, yes. Especially if you have any kind of past trauma. As you said.
I think that's why I wanted a female afterwards, because that was a male, again, like rough, I'm doing it, we're inducing you, it was very...
Another thing for you both to talk about with you and your husband, like if they're standing there alongside and another guy is, it's all very interesting situations. So what are you both comfortable with, and know the necessity in that you can say no here.
Yes.
Can say no, but it won't.
You can totally say no, because it's totally not going to tell you any data.
Yeah, and from evidence-based birth, I read that if you don't want it and you're feeling worried, just keep your pants on when you go in for your appointments, and then they can't do anything, and that's an easy way to be like, nope, I don't want this today, and it gives you the backup to feel more confident and like, no.
Yes, doesn't have to be internal if you're not in labor.
I actually don't think I even was aware that cervical check started so early, because it was so much more hands-off in my prenatal care. But in labor, it's so routine because they're tracking how dilated are you. That's a thing that's being charted. So it's continually being checked. And this one gets me because one of the reasons I didn't want a cervical check is that labor is intense and you don't know how long it's going to last. And so I didn't want to hear that I'm only at 3 centimeters if I'm feeling like, oh man, right? Because it doesn't mean anything, because you could go to 10 in 2 hours, in 1 hour, or you could be stuck from 7 to 8 for 5 hours, or like for me, 8 centimeters, I was like, great, I'm gonna have my baby soon. And then I saw 5 hours of like intense labor and transition, when it felt like I'm at the finish line, but I wasn't 10. And so there's no rhyme or reason for how long it will take to go from 1 to 2, 2 to 3, any number in there. And then the things that happen that make you shut down are things that can contribute to stalling your labor if you suddenly feel unsafe or mentally psych yourself out. Either way. And I think a lot of times it might push you to go to an epidural sooner because you're like, oh, I'm so defeated, I'm only at this amount.
Which I've seen it happen
so often. People are just like, there's no way I'll get there.
Yeah. Or, there was a lady that she was for so long and contractions were so hard on her stuff that she thought like she was like 9 centimeters, and when she got there she was like 1. So yes, that would tell her like, okay, just do whatever, like
because now you've gone to the finish line, and that's one of those important mental pieces, that you can't go to the end of the race. You have to stay right here. And if you're hearing like, I'm 1 and now that feels so far off, I can't do it, you've just defeated yourself.
Which again, let's go back to the same thing. It doesn't mean anything, because you could go from 1 to 10
super quickly. Absolutely. And if you were just staying in the present and believing you were further, you're just like, okay, we're doing this.
Yeah.
So use it sparingly is a huge caution, and realize that the information that you feel like is going to help you because you have information can set you back one way or the other. Both thinking you're closer than you are, or thinking you're so far away when you could be.
I mean, I would say you could use it, now that you know this information, to how can you use it in a proactive or positive way, right? Because if let's say you're too not a lot of dilation, then is that for you to say, okay, relax and breathe. Let's bring more relaxation, because part of stress and like feeling too much, your cervix is feeling it, so it's closed. So if it's that, can you use it as an encouragement into, all right, let's keep doing the relaxation techniques and breathing. And even when you're having contractions, like your jaw, it's very paired with your pelvis. So is it that when you're having contractions, you're not relaxing all of this? Yeah. So that might be a practice. Okay, so then let's practice, relaxing up here too. That's what you hear when you're having contractions, right? Like not tense out, but let go.
Don't thinking your neck and jaw.
Yes.
Relax jaw. Loose, low sounds.
Yeah.
The exception here, I would say, is probably if you have an epidural, because right, like even 10, people want to check if you're 10 centimeters to push, but if you are feeling everything, you're gonna know when you have to push.
Oh, yeah.
You will feel it. If you are numbing the experience, like and can't feel it as much, that's the time where you don't necessarily have as much of a choice, because at that point you're gonna feel pressure. I think most women say. Some women it's not working completely. Like there's different variations to what you're feeling, but that's where the information might be necessary to help know. Okay, you're completely
Open.
set to push.
Yeah. I mean, for me, I felt every time I felt like I was gonna poop, and that was the head there.
Absolutely.
So I learned that very quickly. It's like, so I knew like when I'm like think I was gonna poop, because also I was like a little shy of like you said in your birth, like, oh, I don't want to poop.
Yes.
But I realized that pooping sensation was the head coming.
Yes, it's a very similar to a urgent trip to the bathroom. There is, right? Like it's just so much like there's nothing I can do to hold this in, but it's your baby. How I felt towards late labor was literally, it felt like, I mean, my first baby was 8-12, so like a 9-pound bowling ball was sitting in my groin. That's how it, and you're just like, that's where in the sensations, for me with that labor, it was so much more pressure and intensity. So you're like, it's not pain in the way we think of pain. Like certainly it is intense. It is so much that it's overtaking you, and in ways you feel like you're gonna break apart, but it's just like this immense pressure. And so you don't need to know you're 10 centimeters to say like, that bowling ball is not gonna sit in there any longer, it's coming.
Yeah.
And then it's wild with all the things we talked about of how your body did open up. Like it's truly miraculous how smart and wise our bodies are, and how we can trust in their innate design.
Yeah. And another thing that I, looking back to, like my first pregnancy too, like how detached maybe I was from my body, right? Because my last one, I was reaching down and touching and like feeling my baby, while the first one, you know, like I was just being told to do things.
Yeah.
So to be okay with yourself and to touch yourself, you can still do that.
Actually, that's incredible, because you're like, how are we so okay outsourcing it to whoever the provider is, or sometimes often a stranger or a man that you're like, oh yeah, just you go up on there, but we're like, no, I don't want to touch it. And you're like, no, it's your baby right there. And just shifting that, like normalizing that yeah, it's like you can be all around there as much as you want to, and feel a baby, like your baby's coming out, and it's so hard to believe. Number 4, you got there.
And also know that cervical checks, right? Like to know dilation, your body also has ways to see that their baby is coming, that baby is descending. Have you seen like in the sacrum area, the rhomboid? It's a rhomboid something that it creates in the back, in your right pelvis and in your sacrum. It goes back and it creates like a diamond shape, like dark diamond shape. That's how you can also tell that the baby is descending and you are dilated.
Like a line, and it creates like a line in your back. Is this
so
right?
That's the second one. There's two. You see the rhomboid shape, and then you see a line like from the butt crack up. You could see like the higher is, the more dilated you are. So those are things to see, right? Innately see, to know that their dilation is happening.
Not easy to see though if you're sitting on your back.
Well, no, I'm saying for other people, because you wouldn't see it.
Sorry, I'm just saying in general. Nobody can see it if you're sitting on it. So just get up and move. It's gonna help you in every way. Like how wild.
Yeah.
And those exist. I didn't even know that.
Yeah, that's ways
cool.
to know dilation.
So when your provider's behind you, they get a better view.
And I have seen it, and it's amazing, because you can see like, oh my God, like she's so close.
Yeah.
Because you see that.
Very cool.
So again, you need to go internal to know that dilation is happening. There's other ways.
Yes. Go off what you feel comfortable with. Know that you have the autonomy, and know as a complete sentence.
And know that your body is built for this. It's just how much in touch you can get with your body, with your intuition, and trust that your body knows how to do it, and that it's gonna do it. You don't need any intervention to assure you that you're doing good.